Neonatal respiratory distress syndrome compromises breathing in underdeveloped lungs, which lack adequate endogenous surfactant to reduce surface tension and avoid atelectasis. CUROSURF Peractant Alpha intratracheal suspension is indicated for the treatment of respiratory distress syndrome in premature infants. CUROSURF reduces mortality and pneumothoraces associated with RDS. CUROSURF is administered at an initial dose of 200 milligrams per kilogram, which makes it unique among exogenous surfactants. With nearly twice the surfactant dose, CUROSURF delivers the highest phospholipid and SPB concentrations at a reduced volume. CUROSURF's low volume helps facilitate efficient administration. The thin suspension minimizes airway and endotracheal tube obstruction and associated complications such as transient hypercapnia. Once in the lungs, increased SPB content has been associated with improved spreading and dynamic respreading in the alveoli. CUROSURF's combination of protein and phospholipids promotes generation of a greatly enriched DPPC monolayer that exhibits high film stability. The monolayer helps reduce surface tension, improving lung compliance and gas exchange. CUROSURF facilitates oxygen diffusion from alveoli to capillaries, leading to improved oxygenation within 5 minutes. Improvements in oxygenation have been shown to persist up to 72 hours after the initial dose. In a recent study, the 200 milligram per kilogram initial dose of CUROSURF demonstrated longer DSPC half-life in the lung, better gas exchange, and higher rates of single-dose success than a 100 milligram per kilogram initial dose. Similar high rates of single-dose success have been demonstrated across multiple clinical studies. The 200 milligram per kilogram initial dose of CUROSURF offers low volume for efficient administration, rapid onset of action, sustained results, and high rates of single-dose success. Experience fast RDS success with CUROSURF. Important safety information. CUROSURF is intended for intratracheal use only. The administration of exogenous surfactants, including CUROSURF, can rapidly affect oxygenation and lung compliance. Therefore, infants receiving CUROSURF should receive frequent clinical and laboratory assessments so that oxygen and ventilatory support can be modified in response to respiratory changes. CUROSURF should only be administered by those trained and experienced in the care, resuscitation, and stabilization of preterm infants. Transient adverse effects seen with the administration of CUROSURF include bradycardia, hypotension, endotracheal tube blockage, and oxygen desaturation. These events require stopping CUROSURF administration and taking appropriate measures to alleviate the condition. After the patient is stable, dosing may proceed with appropriate monitoring. Please see accompanying full prescribing information.